Hi, I'm Mary Flynn. Thank you for coming here today for the lecture on health benefits of olive oil. I work at the Miriam Hospital. I'm a PhD in nutrition and a registered dietitian. I do research there on the health benefits of a Mediterranean diet, specifically on olive oil. That's why I've been asked to do this talk today. Now, there are different types of olive oil. Olive oil can either be extra virgin, it can be just plain olive oil, or it can be pomace, P-O-M-A-C-E. And it makes a difference which one you're talking about. Extra virgin olive oil refers to the olive oil that's closest to the olive. It's basically when they press the oil out of it, you have extra virgin olive oil. Sometimes it says cold press, and people are very fussy, choose the cold press. If it doesn't say cold press, it hasn't been treated with heat per se. It's the way that they spin it. When it just says olive oil, it's a lesser quality olive. It's a mixture of olives. Usually all of them are poorer quality than the extra virgin, and it's more refined. And then pomace is what's made from the skin, the pits, the stems. It's not good olive oil. It's very poor quality. Some people use it for frying, but you should not use it for cooking. It would not taste very good. The health benefits are with the extra virgin olive oil. That's where you have all the health benefits, and those are the health benefits that I'll be speaking about. Just before I speak about olive oil, though, remember that olive oil comes from olives, so olives also have health benefits to them. Now, when you look at the data around the world, people who eat a diet that's moderate in fat, that uses olive oil daily, have much lower rates of chronic diseases, much lower rates specifically of heart disease and a number of cancers. Now, when you talk about how olive oil can impact on the chronic diseases, you can look at the different risk factors for the chronic diseases. So first I'll talk about heart disease. Your risk factors that can be affected by olive oil are the blood fats that you have in your blood, your level of triglyceride, your level of cholesterol, how it's being carried, the level of oxidation in your body. Your body oxidizes all day long because we breathe in oxygen, but you have to keep oxidation under control. If oxidation is not controlled, you increase your risk of heart disease, cancers, it contributes to aging, and you can look at oxidation from the standpoint of how olive oil will affect it. The other thing that other things olive oil can affect is blood clotting, blood pressure, and also inflammation. Inflammation is a new thing in the area of disease in general, but inflammation is becoming a real hot, important topic. Daily use of moderate amount of olive oil, as I said, will decrease the risk of heart disease. And this is how it does it. When I say moderate amounts, it's 2 tablespoons a day. At the end, I'll talk about some ways of incorporating olive oil, but your goal is to try to get 2 tablespoons of olive oil a day into your diet. Now, when you look at olive oil as a fat, it is a source of fat, but it's a very healthy fat. Fats don't all have to be bad for you. Olive oil is one that is very good for you. The type of fat that's in olive oil is primarily monounsaturated fat, mono being one, it has one double bond, and that means it doesn't oxidize, it does not break down. Monounsaturated fats can also lower LDL, the less healthy carrier of cholesterol, and raise HDL, which is a healthy carrier of cholesterol. Olive oil is also low in saturated fat, the solid fats, which raise LDL, so it's low in that. And it's low in polyunsaturated fats. Poly means many, and they refer to the fats that have many double bonds. It's 2 or more double bonds. Polyunsaturated fat is what is in soybean oil, corn oil, safflower oil, and in canola oil. And polyunsaturated fats do break down. They do oxidize. So using olive oil means you will control your oxidation first off. Then olive oil has in it a whole host of antioxidants. When I say antioxidants, you're probably thinking of vitamin E and possibly vitamin C and beta-carotene. Beta-carotene is not actually an antioxidant, but it gets classified for the public that way. But vitamin E comes in 8 different varieties, and the most active antioxidant of vitamin E form, is alpha-tocopherol. And that's the type of vitamin E that's highest in olive oil. In fact, of all the oils out there, extra virgin olive oil has the highest level of alpha-tocopherol, the antioxidant vitamin E. So olive oil doesn't break down, and it contributes the vitamin E. It also has other compounds that are called polyphenols, meaning many type of phenol ring structures that work as antioxidants. The other components in olive oil come under the category of what are called phytonutrients. P-H-Y-T-O, nutrients. Phyto being plant, and these are nutrients found in plants that protect the plant from its environment And when it's been found that when you isolate these phytonutrients and look at what they do in the human body, they will explain why there is less chronic disease. Now, the olive itself has many different phytonutrients, but some of them can work as to work in blood clotting. If your blood clots too much, you're much more likely to have heart disease and cerebral vascular disease, strokes. So olive oil has components that stop the blood from clotting. It also has components that will break up any clots that are already there. 2 tablespoons of olive oil a day will lower your blood pressure, and it probably does that through lowering insulin. Olive oil has components in it that make insulin work better. So 2 tablespoons a day have been shown to lower blood pressure when it's compared with another oil, a polyunsaturated fat oil. So just 2 tablespoons will lower blood pressure. Olive oil also has components that are anti-inflammatory. Inflammation is measured now with C-reactive protein. Sometimes it's CRP, but C-reactive protein is becoming a real hot issue. And olive oil has components in it that will lower your level of C-reactive protein. And as I mentioned with blood pressure, olive oil has components in it that will lower insulin. And make insulin work better. So it lowers your insulin, it lowers your glucose. High normal levels of insulin will increase your risk of heart disease, breast cancer, colon cancer, probably other cancers. Insulin is needed for certain functions in your body, but if you have too much, it will contribute to disease. So those are the things that are in olive oil that make it healthy. Then also, if you look at how much olive oil, when I say moderate fat, and I mentioned the 2 tablespoons, it should be at least 2 tablespoons. If the diet is too low in fat, you will raise your triglycerides and lower your HDL, both of which are not good. So using more than 2 tablespoons would be better if you could do that. Now, as far as olive oil and cancer are concerned, there are a number of studies that have been done in the Mediterranean countries, the countries that typically use olive oil. And what they're doing is they can look at people who were raised through the 60s and 70s. In the late 60s, early 70s, there was a changeover in the countries where there was more Americanization of the diet. So they had more margarines being used, more vegetable oils being used, more ground beef. And some people in those countries were raised on the traditional diet, which uses olive oil and not a lot of meat. And then some people were switched over to a more American diet. And now we can look at rates of disease in the people. And it's very consistent that people who use olive oil daily have much lower rates of breast cancer, colon cancer, and lung cancer. Lung cancer is interesting because there's at least as much smoking there as there is here. The one that I am most interested in is olive oil and its relationship to breast cancer. Olive oil has components in it that can lower cancer, and I find it, I am particularly interested in this area because many women who have had breast cancer or women at risk of breast cancer think that they should eat a low-fat diet. And a low-fat diet actually is not good for someone who has cancer or is at risk for cancer. When you look at the rates of breast cancer in the Mediterranean countries, you find that in Greece, Spain, and Italy, studies have been done. Women who were raised on margarine, they're the ones who get breast cancer. Women raised on olive oil, the more olive oil they consume a day, the less likely they are to get breast cancer. Now, again, to look at the mechanisms, olive oil has a component in it called squalene, S-Q-U-A-L-E-N-E. Squalene is a phytonutrient that will break cancers that have started. It will stop the cancer so it doesn't get going. This has been shown in test tubes, and it's been shown specifically with breast cancer cells that it can stop that. As mentioned with heart disease, olive oil does not oxidize. So you don't have any oxidation contributing to cancer. And you have the vitamin E, the antioxidant, which again decreases the concern for cancer. Olive oil, with its ability to lower insulin, make insulin work better. High normal levels of insulin will increase your risk of breast cancer. So if you can get your insulin down, insulin is more likely to be measured in a research setting. You folks wouldn't know it from clinical results. But if you look at it in a research setting, olive oil makes it come down, which would decrease your risk, certainly of breast cancer and colon cancer.